We know that this virus is spread through close contacts, and we've been messaging since the beginning of the pandemic to reduce the number of contacts. And especially now, it's very critical. In fact, right now, our contacts should only be really our household members for the most part. Well, a case over the weekend had 85 contacts. Right? We can't manage this pandemic if cases have 85 contacts. And that's what we've been messaging Manitobans. Keep track of your contacts, right? That list should be very small right now. It should be mostly your household. But 85 contacts puts us all at risk. We can't accept that. One of the big tools that public health has is contact tracing. We find a infectious case and then find those contacts, certainly hopefully not 85 of them, but we notify them to self-isolate because should they become cases, they're not going to have contacts, or at least not many, and will decrease that transmission. So our contact tracers, mostly public health nurses, have been increasingly receiving verbal abuse. They're calling people to inform them that they're cases, they're calling people to inform them that they're contacts, and they're getting yelled at, sworn at. Like, we are all in this together. We have business operators yelling at public health nurses because they're advising them that employees are ill and will need to self-isolate. I don't understand the thought process behind that. Should we have infectious people at your store, putting your patrons at risk? So we can't accept this behavior. You know, it's tough. If you're now notified your contact, you have to self-isolate for 14 days. That's difficult. But it's certainly not the public health nurse's fault. It's the pandemic, and this is our best way to minimize our numbers. So we cannot accept this verbal abuse to our healthcare staff just for doing their job, just for trying to protect Manitobans. You know, we see in Steinbach where that hospital is under a lot of strain. The healthcare workers are working as hard as they can to keep up with demand, and yet on the same day we have a protest, a gathering. Right? We're announcing double-digit deaths every day, and then we're protesting things to try to reduce the impact of the virus. Right? How can we reconcile that? Right? This is not that time. This is the time that we need to have a united front against this virus. It's difficult. I know many people, including me, wish we didn't have to do all these things, but we have to right now. We cannot sustain the numbers that we're seeing. We have no choice. We know it's very unsettling to hear these numbers day in and day out, to hear me send condolences to families and loved ones every single day now, double digits. But on that note, we know exactly what to do. We can make that change right now. We can't see these busy stores on the weekends. We can't have people having 85 contacts. We have to minimize that now. And it's tough, right? We're missing celebrations, missing milestones like birthdays. We're telling our kids you can't go out and play with your friends right now. So these are very challenging times, but we can see how challenging it is right now for our healthcare providers on the front line. It has to be very clear, our hospitals are running at capacity now. We can't sustain these numbers. So no matter how difficult it is, we all have to step up now. And it'll have to be together. So thanks again. I know there's lots of Manitobans who have always been stepping up. I know now people will be stepping up even more. Thanks to our healthcare providers at the front line. I know that these next couple weeks are going to be very challenging. But thank you for all your hard work and dedication to Manitobans. And we're all going to step up and try to decrease that demand on your services. So thanks again. I'll pass it to Lynette.